Okay, thank you. And seeing some interesting responses on the poll already, we'll be really happy to share those results with you at the end. Just to get started, I wanted to thank everybody for hopping on with us. We see this as a really important topic, especially after we've all been through a pandemic. It's not just a matter, marketing is just not a matter of telling people that we're open, but addressing the real concerns that people now have for their safety. And that's on the patient side and on the provider side. So it is not enough just for us to do the right thing and put out the right policies internally. The data that we're seeing from campaign performance already shows that we have to be in front of our patients communicating that message of safety. So the people that we've gathered today, Jared, Dave, Sarah, they have wide experience in many different organizations and many different modalities. And we thought it would be a good way to let not let them not even only go in depth on their own experiences, but also have a dialogue where you're able to ask questions and have those answered directly by the people in the webinar. To assist with that dialogue, we've set up a Q&A panel with the Zoom webinar. So at the very bottom of your screen, you should see a Q&A button that will allow you to ask questions. And so we'll address those questions directly at the end. Keep the questions flowing in. We already got some good questions coming in from the initial registration. So we're looking forward, the whole panel's looking forward to speaking with you on the issues and concerns that you have. So just to start off, one thing that happened whenever you registered is we asked a question: how could data-driven marketing aid your recovery efforts? Nobody answered with an answer like analytics or data storage or statistics. It's all about what we can actually do for patients, how we can identify the right people to revive specialties that have been temporarily furloughed, and ultimately how we can use data to better plan our efforts. So this word cloud comes from those responses. And of course, there were some responses that really stood out, really built into that theme, such as from Susan Tishak at Nebraska Medicine. It would make us all more strategic and focused on our efforts to drive more impact. That's a huge shift from campaigns that are run by gut or what's been typical to using data to drive those campaigns and strategies. I really liked what the response we got from Kim Reynolds at Forum Health too, because by mentioning the population health initiatives, the end game for them is also the same: patient engagement, getting patient, basically influencing patient behavior. So this is a good way to look at how can marketing contribute to those efforts? What part does everybody play together? And Susie Wolf, valuable fact-based information. We're going over themes around data enthusiasm and really understanding how to work with data. So that really plays into the theme that we're going for as well. So that's super tied to our objectives, which are to kind of introduce this concept. We've been talking about it. You might have seen the post from Brad Hawkins, but learn about what this concept, this emerging concept of a data enthusiast is, and how we can use data to help build value for executive leadership and relevance for marketing, taking ownership of reporting and avoiding bias from the various vendors and conflicting reports that you'd be receiving. The way we're going to do that, we tried this format out in the previous webinar and it really worked well. What we'll do is we're going to go through this introduction section. We're going to let the speakers deep dive into their own perspectives, and then we'll have them give each of their perspectives on a speaker panel. So we've got some prepared questions we're going to work with. Sarah is going to top it off with some key takeaways from the presentation, and then we'll get into the questions that you guys have posed to us. So just to start off with this concept of data enthusiasts, this Venn diagram is pretty common on the data scientist repertoire. And what it's saying is that a data scientist, the representation of a data scientist, is being extremely skilled in programming, working with software systems, statistics, the ability to understand algorithms, and a deep subject matter expertise. That's the ideal data scientist for the healthcare marketing space. But there's all kinds of different roles and different things that fit into this, such as if an individual is extremely skilled at programming and has deep healthcare subject matter expertise, that would fall more into a software developer role, and a data analyst is somebody who has the subject matter expertise and the stat background to provide analytics for an organization. The concept of a data enthusiast is to combine the deep subject matter expertise of a pure practitioner along with some of the stat knowledge, some of the knowledge about how algorithms work and how different AI platforms work, to be able to help the health system across the enterprise make good data-related decisions. So we're focusing on the data enthusiast from a healthcare marketing perspective, but the idea is that this person who learns about these other platforms, it's not a matter of learning SQL and learning Python, learning R, but it's really just a matter of understanding how these things work from a business perspective and how they deliver value to ultimately be able to influence these types of decisions, the technology decisions, being able to communicate with senior leadership about data-related issues and about metrics, being able to align on that perspective. So being a data enthusiast, there's no college curriculum or anything like anything for that. It's a kind of a concept of how can I, in my role today as a marketer or as a liaison or as an outreach leader, how can I, in my role today, upskill to the data fluency and data literacy to add value for the organization. Some things that can help get started. Dr. Eric Topol wrote Deep Medicine, which is kind of a survey of all the things going on up to 2018, all the things going on with artificial intelligence within healthcare. Health Catalyst also has a really good guide called their Analytics Maturity Model, which can help you think through at the lower level the data governance issues, and at the higher level the artificial intelligence and direct-to-consumer issues that help identify and strategize on how you can make data actionable for your patients. Also, I encourage an understanding of the organizational metrics, as well as things like understanding Judea Pearl's Book of Why. This is a book about causality, but it's written in layman's terms. And the idea is to understand, like we do A/B testing, we do randomized control trials and things like that, but there's all kinds of other ways that we can start looking at attribution. And this is a great way to start understanding what some of those other methods are. And no matter how good you are, no matter how solid your analysis is, and no matter how much ground truth you have, it doesn't mean anything if it's not being communicated effectively. So how do we convert those metrics, those things that we're understanding, into stories that resonate with the audiences that we have, clinical leadership? How do we tell those stories to the various people in our audiences that need them? Another thing to really take note of in this data enthusiast mindset is the ethical component. Every data decision has an ethical component, and it's clear that there were some ethical gaps in terms of the algorithms and different things that were being deployed last year. There's more information on that in Brad Hawkins' article, but it goes into some of the mishaps that we saw with algorithms that would discriminate based on race or discriminate based on sex or gender. It's important to have an understanding of those ethical concerns to better develop and better lead for your organization. So I just mentioned a couple of books, The Ethical Algorithm, and this book by Kathy O'Neill is really solid, Weapons of Math Destruction. That's a good way to get a solid grounding, good baseline in data enthusiasm. And then the things that you can kind of keep up with. Obviously, we have Jared Johnson, the Healthcare Rap podcast host here. He goes into, it's not necessarily a data science podcast, but he does go into specifics about data-driven efforts a lot. Great podcast to subscribe to. And another favorite of mine is from Chris Penn, who is a data scientist, but also a marketer. So in his Marketing Over Coffee podcast, he's always talking about the latest and greatest that's going on with data science and marketing. Also, this is Google's Chief Decision Intelligence Officer, Cassie Kozyrkov. Google this article, Data-Driven Think Again. I've been working in data for years by the time I read this article, and I found out that I wasn't in every aspect data-driven. It's a great way to get a baseline on the heuristics that you should be thinking about if you want to truly be data-driven. Cassie puts out a ton of content focused on leadership and AI decision-making, so she's also a great person to follow and keep up with as well. So for an overall introduction to our speakers, we have the Healthcare Rap host, Jared Johnson. He's in the house. Dave Paveletz leads digital and AI-based outreach efforts at Virtua Health. He's got a great story to share. And Sarah Coles, she heads up Symphony RN's marketing efforts, Symphony RN's marketing services for health systems across the nation. So we're gonna dig deep on each of their perspectives, starting with Jared. So just go a little bit deeper on Jared. He's one of healthcare's biggest advocates for data-driven and precision marketing. He's led tech-enabled efforts at St. Jude, Phoenix Children's, and now he works with health systems across the nation. He also founded Shift.Health and the Healthcare Rap podcast to be an entertaining source to stay on the cutting edge of healthcare marketing and what's going on in that realm every week. So Jared, there's so much data in so many systems, and health systems have to move faster than ever. What should healthcare marketers be focusing on for a valuable MarTech strategy? And you can go ahead and steal the presentation from me.
Oh, you bet, you bet. So thanks first and foremost for having me be a part of this. I love anything like this. I love the term data enthusiast. I think that's what I'd call myself at heart before we even had
Jared,
that as a term. So
can you share your screen?
Yes, let's, okay. Here we go. All right, you got that now?
Yep.
So what I was thinking about this topic, I thought, so what's changed? Like if we had this conversation 3 months ago, and it's very clear to everyone what has changed to everything, not just about marketing itself, but the complex science of it. And what does that mean specifically? Not just, hey, we need to unpause things that we paused on a dime a few weeks back. I'm looking at the next 12 to 18 months. I'm not just looking at the next week or month or quarter. I'm looking at over the next 12 to 18 months. And the more I've talked with other health systems, with consultants, with others out there who are really studying this, I'm more and more convinced that this is going to be a long-term situation. Starting off with the fact that the pool of those who we want to acquire for any type of procedure or really any type of patient interaction, that's going to be a smaller pool to begin with. When you think about the tens of millions who have been unemployed, who have been furloughed, laid off, and just disrupted from their own jobs and from their income and from their insurance, more importantly, then that pool is going to be different to begin with. And so we have to start with some different assumptions in terms of how to re-engage on any types of campaigns and data-driven marketing. The assumption can't be that the same pool is there. There's going to be a lot fewer commercially insured patients to begin with. There's going to be some hesitancy among them. We were just talking before we went live here about how your Medicare pool is probably going to shrink too. So that's a big consideration. So the pool is going to look different to begin with. Then those within the pool, consumers, everyone, we've been told to stay home for all these weeks and months, and getting through that is going to be an endeavor in and of itself. That is not just as easy as putting out a message that says we're open for business, come on back. In between there, we have all had to experience what we've seen. I mean, we had to, hospitals, health systems had to put that message out there, and any content that we've had has been, yeah, don't come in for your own safety. And so to just turn right back around and think that people are going to be okay with a message that's completely, 180 degrees different, we just have to be conscious of that. And I think that's going to be a piece we don't want to underestimate, the fact of how complex that's going to be. We can't just say, hey, it's safe to come back. We have to really dig into the message itself, and part of everything we talk about today revolves around that. What is that new message? I've heard discussions about whether that should be COVID-free versus the word just safe, but that's going to be part of the discussion moving forward. And a third major consideration, kind of a macro theme that I've seen, is just an overall greater interest in public health, which when you talk about the data that's at our fingertips and what type of messaging needs to go out there, that ought to be integrated more into what we're doing. Even though we're dying to fill up a funnel again, we're dying to bring people back as quickly as possible to make up for lost time, we can actually run the risk of shutting them off really quickly. So I feel like the opportunity here is more than ever to leverage your first party data to truly meet consumers where they are. And that takes into account all those macro themes I was just discussing. And I think that's just kind of the lens to look through everything we talk about today, is what's the opportunity and what are the missteps that would be too easy to take if we don't think through that part.
Jared, I just wanted to thank you.
Oh, there we go.
Yeah. Wanted to thank you for sharing that perspective. And we're going to jump over to Dave.
All right, thanks, Chris.
No problem.
Switch over.
Yeah. So well, I just want to do a quick introduction first.
Yeah, absolutely. Go for it.
So yeah, sure. So Dave's role as Virtua Health CRM marketing strategist has him using AI-based analytics to help find and strengthen relationships and loyalty within their population base. So he's got some unique talents that he's going to share and perspectives that he's collected not only from his work with this organization, but he's also served at Einstein Healthcare and in a number of other analytic and strategic type roles. So it's a great mixture of a role that we have in Dave. So Dave, and feel free to steal the screen from me anytime, but given your experience working with AI platforms, what challenges do these platforms actually address? I'm looking at some of the responses that people have in the poll to AI platforms, and I'm curious, what challenges do you see them addressing, and how do you know when you're actually successful using these types of platforms?
Absolutely, and I'll walk everybody through that. I just want to make sure that you can see my screen.
I don't yet.
Sarah and Jared are giving me the thumbs up.
We got it.
Okay.
Got it? All right. All right. So, in its simplest form, healthcare is really not much different than retail. Everybody always is like, oh, we're, it's so much different. I've been outside the healthcare industry. It really isn't that much different. Everyone has a need or a want that they want to research, and then they select what they want or who they want to go with. So this is where AI and healthcare marketing has really entered the playing field, because consumers have evolved to really expect more. And this is really that Amazon effect that everybody talks about, crossing across multiple industries. So it leads to the challenges that can be addressed. And I could take up this whole webinar discussing the challenges that AI can address. But for the sake of time and everyone's sanity on the webinar, I'm going to focus on the hot topics in healthcare. And that's really that consumerism piece, and more specifically that personalized and getting the right message to the right person at the right time. So you're seeing in healthcare now is a big shift from business to business to direct to consumer. So physicians aren't really the driver anymore. The patient is, and we really have to change the way that we change the way we think and understand the way that our consumers think, because there's a lot of people coming into this realm now that we never expected to be here, that has data, is utilizing data, and does have that understanding. So the classic model for direct marketing in healthcare has always been, what's good for the goose is good for the gander. And the shift has to be made in healthcare to become more personalized, especially in an industry that, for the most part, is one of the most empathetic industries out there. So we know how to treat our patients well, but do we really listen to them and get to understand them and put this persona to them? So what does a day in their life look like? What are their pain points? What do they value most? What are their goals? And especially now in this in this new unprecedented daily routine, is how do we keep them safe when they come back? So that, and what AI does is it enables that personalized targeting and really stops us from generalizing and puts a face to that persona. So now I'm going to get into the fact of artificial intelligence really takes the data that you have internally and combines it with really any outside data sources that you have, whether it's demographic, internal data, third-party data. And what it does is it produces this target that you're looking for. And it could be multiple targets. For the sake of this, I just put one here. What it'll do is throw it out across your population. So it says, okay, here's this persona, here's who we should be marketing to. They're most likely to utilize our services. And what it does is it stratifies it across there and really does the work for the marketing team to say, this is the segmentation and this is the persona. And it really changes the way we market. So it takes me over to, this is what the old patient journey looks like. It's very transactional and impersonal. And I hope you're feeling this slide as little arrows are bouncing. Now imagine how this feels to a patient, right? They can be anywhere between, 24 hours to 6 weeks to academic medical centers that take up to 6 months in between these touch points. And, what you do now is you would take that persona that you've done and you've utilized with artificial intelligence, and what you do is you drop that, that impersonal feeling there, that detachment. You drop that time limit in between there, and what you do is you start building this relationship. So what these little starbursts are here is really personalized content and messaging that you can utilize in between those transactions, personalized to that persona that you've identified with artificial intelligence, and you can understand those concerns as you come across these paths with the emotions. You have concern, you have anticipation, you have uncertainty, you have anxiety, you have people who are hopeful after treatment, and then realization. And realization always isn't you're good and ready to get back. Sometimes realization is, I have this disease, this is how I live with it. And that's how you continue to nurture those patients and keep them in that customer relationship and build that relationship with them, is you don't drop it after realization. You continue to engage with those customers. So what is success? So the smart thing to understand is with AI, there's both hard and soft benefits. Those soft benefits are your understanding your consumer and your patient's intent, their interest, their engagement levels. And then we start getting into those hard benefits of, conversions and revenue. And then, AI helps us with these personas to be able to target these patients. And, the number one success is that we're able to bring them back as a customer again. So what AI is constantly doing to engage that is understanding the content you're sending out, understanding the emails you're sending, understanding who you're targeting, the keywords that they're searching for, the analytics behind what we're sending to them. AI is compiling all that, and it's constantly learning to retarget and continue to target those patients, to develop better personalized content, to be able to understand engagement and how people are engaging with your health system. And ultimately for Virtua, what success was for our breast health campaign that we launched in January is we had a 350% increase in mammogram orders versus our control group internally. We exceeded the industry benchmarks by close to, if not over, some 300% in some areas of open rate, click-through rates, and form conversions. And this is what I was talking about in the realm of those soft benefits. You're understanding how these certain patients are engaging with you and consuming what you're sending out. But the most important thing is we're gaining new insights daily. This was brand new for Virtua when we started. So for us, it's understanding that intent, that interest and engagement, and constantly learning and being able to utilize that for marketing campaigns in the future. And then, we're still and always learning. So we're looking at the voice of the customer and what they're providing to us. We're looking at the analytics and the results in the background. And the important thing with AI is that you can always pivot on a dime. Chris mentioned it earlier, A/B testing and all of that. You're gauging that across the board. So it's always great to hear those hard benefits of these increased orders, the increased revenues, the increased conversions. But it is important to always stress across the organization that there are soft benefits that people may not notice, but keep you connected in the long run. Chris, you're on mute.
Sorry about that. Yeah, I lost my audio there. Thank you very, very much for that. Love those perspectives, and we've been getting some questions that are going to dig a little bit deeper into what you presented earlier. So where we're going to go now, Sarah Coles, you see her on your screen. She heads up marketing services at Symphony RM, and that has her directing health system marketing initiatives across the nation. She's got senior leadership experience within healthcare and also within other industries. And she's also been super instrumental in helping hospital marketing teams transition into the data enthusiast and data science mindset. So Sarah, Darren Birch, he spoke on our webinar last time and from Legacy Health. And he said that hospitals are moving so fast right now that decisions that took years are now being done in weeks. So given all these complexities around COVID-19, as far as the complexities are bringing in for incentives, modes of care, and operational safety, what's the impact for marketers and marketing technology as they're charged to bring back patients safely?
Thanks, Chris. I think all of us as marketers can probably attest that we feel like we've done years worth of work in the last few weeks. So that quote or that question rings true. It's true that COVID-19 kind of hit us like a wrecking ball. None of us saw it coming, but the good thing is that some really interesting opportunities came out of it. Digital tools have taken off like never before. I don't think any of us ever expected that telehealth would become such a big thing so fast. And that and contactless delivery, using digital tools to communicate has just really been an incredible opportunity for all of us as marketers. But even more so, the data and data-driven decision-making has really come to light. We've been using data for a long time in our decision-making, but I think through the whole COVID-19 experience, and as we continue to experience it, data is playing a real front and center role in terms of what patients and even what providers we want to reach out to at what time and for what reason. And so I added here the terminology precision marketer because we are now really precision marketers. We're no longer just marketers. We're the conduit between patients and providers, and everyone on the panel has been talking about digital tools and just new tools and technologies being used to reach patients and providers, and we as marketers are kind of that conduit and that real opportunity to help break down those four walls, those traditional four walls between patients and providers, using tactics like patient education, new opportunities for activation, personalized nurture campaigns, and above all, data. So I think first and foremost, this is the time to communicate often. We've heard the question that, are we over communicating during this time? Healthcare organizations are really sensitive to what they're communicating about, but we're seeing data rate, open and click rates anywhere between 25 and 65% higher than what they were before. So people want to hear from healthcare organizations. They want to consume that content. They want their healthcare organization to be a resource. So communicating often is really a priority now. And the other part of that too is the more that you're communicating, the more data you're gathering. So you're better understanding what content people want to hear, what channels they want to hear it from, and what calls to actions are working. And personalization, I think we can all agree that personalization drives higher conversion rates, but personalization is more than just adding a person's first name to the salutation of an email. It's about really personalizing the content, the call to action, the message. What you're seeing on the right-hand side of the screen here is an example of one email outreach that went to one audience, but it had 3 different calls to action. This is an appointment recovery campaign. Depending on the patient's appointment type, they either got a message to book a telehealth appointment, new safety procedures that would make them feel more comfortable about coming into the office, or important information about scheduling their appointment because they're high risk. So it's one message really about coming in for an appointment or booking an appointment, but it's customized depending on your appointment type, who you are as a patient, different call to action. And we can use dynamic content and create really personalized messaging that resonates with the recipient. Developing a regular cadence of communication is also something that's really important as we look forward. Mapping out what you're going to communicate, who you're going to communicate to, and how you're going to do it. Developing an editorial calendar can help keep you on track, but it's equally important to think about what kind of content is going out, because as marketers for healthcare organizations, we're responsible for, in many ways, communicating messaging around wellness. Mental, physical, social wellness is all important in today's world. And so being a resource for patients is just as important as helping them come in and book another appointment. Channel optimization, I think I mentioned that we've seen a huge uptick in SMS usage and response in the last few months. SMS has been a really amazing way to reach a lot of patients quickly and disseminate messages, as well as email. And I think as we look forward, one of the things that is on my mind is how we can better understand what channels people are responding to. So is somebody more likely to respond to an and by respond, I mean convert or engage. Are they more likely to click a link if they get an SMS? Are they more likely to go to a website or book their appointment that they need to reschedule through an SMS outreach versus an email? And better understanding that channel optimization over time will help us to more precisely target the people we want to reach. And finally, provider communications. Providers are really on the front lines. They're just as scared as patients about the reopening process. And so providing channels of communication to help them better understand what the new policies are, procedures, cases, and just being an informational resource to them, as they are also a channel that will be used to communicate with patients as well, is really key. They can champion your message, and they need that additional support from communications as well. So just to kind of close off, healthcare is never going to be the same, at least for a really long time. We need to adjust our plans, look at digital alternatives, which are here to stay, and really underscore data as a key way to drive decisions, personalize content, and optimize channels over time. And it's not too late to start. There's a long road ahead. I think we're looking at least a year, maybe two or more of working through these new ways of communicating. And so this is a great time to start now.
All right, thank you very much, Sarah, for that portion of the presentation as well. So we've heard in depth on some different perspectives as Jared and Sarah and Dave all occupy different portions of the industry. Now we're going to get to hear the perspectives on the same question. So we're going to go into our Q&A panel. So the way that this works is I'm going to ask a question, then each person's going to have a chance to respond. So you're able to hear kind of the national consulting type view, the direct healthcare system practitioner view, and the healthcare technology marketing view as well. So what we'll do is we'll start with the question, what metrics are executive leaders focused most on right now? And what's marketing's role in helping to move those? We'll start with Jared.
Great question. This ought to always be in the forefront of our mind. I don't know that the key metrics have changed that much. When you're talking about cost per acquisition, customer lifetime value, and contribution margin, that's what drives the financial viability of hospitals. If anything, they've been looked at even more. And just a keen focus on those is always going to be the best place to start, like to not get lost in the weeds. Engagement rates, those kinds of things are great. They help us know how to refine our campaigns and messaging, but let's not lose sight of those key parts. So cost per acquisition, customer lifetime value, contribution margin. As far as what marketing can do to help, I feel like just understanding what the role of the marketer is, seeing ourselves differently is the biggest thing we can do, right? Paul Zablowski is another national consultant. He is a former chief brand officer for a couple of large health systems in the country. To me, he was the one who coined the phrases contemporary marketer versus obsolete marketer, right? So a contemporary marketer is one who sees themselves as a growth engineer versus an obsolete marketer who sees themselves as just kind of creating pretty things. And so seeing yourself as a growth engineer means you're going to voraciously engage in an internal dialogue about your marketing operations continually. And you're not going to be talking about the activities, the amount of things that you've done or produced or released or published. You're going to be talking constantly about your marketing investments. So you're not going to be going to executive leadership to get buy-in on a marketing budget. You're going to be talking about a marketing investment from the very beginning. Here's what we can expect. Here's based on information that we know. Here's what we can do with that. So thinking of it as an investment strategy, these are things that get in the weeds, but if we don't think about them on a regular basis, then they can thwart our efforts, right? So not even just talking about, just realizing like that's what they want to know. That's what an executive wants to know. We also have to be conscious of how much data we've put in front of them all at once. I can't tell you how many times I had what I thought was like a pretty dynamite looking dashboard, or report of some kind, and had all the numbers that I thought they wanted to see. And they're like, and they kind of wince looking at it and say like, just tell me the highlights. And I'm like, it's right there in front of you. And they're like, no, just summarize this for me. So even just being aware of like how much we put in front of them all at once, that I think spending more time on that internal dialogue is key to helping everyone in the organization understand the value of what's going on with any type of data-driven marketing, especially as you have the tools there in front of you. Communicating that internally, I guess I had operated sometimes with the assumption that everyone else understood some of the basics that I was operating on also, and it turns out it wasn't without a really continual amount of internal communications on that. So I think that's, if we think of that in terms of the marketer's role first and foremost, that's a good place to start.
Awesome perspective, Jared, and I love the reference to information overload, because it goes into how to properly form a data story that actually moves action. So Dave, just given your experience, would you like to expand on that question? So what metrics leaders are most focused on right now, and marketing's role in helping?
Yeah, absolutely. I agree with Jared 100% that much of the metrics haven't changed. Looking at, revenue, contribution margin, but I think some of the stuff that is going to change, moving forward, is the metrics are, who canceled, why did they cancel, when did they cancel, being able to start building that strategy out of how we're going to retarget them. And really, I think where the marketer comes into play with here is really just the market research part behind it, understanding what our market wants to hear. Do they want to, healthcare always historically have a system of telling people what the healthcare system wants to hear. We have to make sure that we are producing out what the customer wants to hear when we're reaching back out. And the other things that are going to be important, obviously, is going to be the daily census, because everybody knows that this isn't going away. They're going to have a plan that's set around what the census looks like in terms of the COVID patient for bed census, and additionally, what patients we're going to bring in and how we're going to target them, which ones make sense. It's going to be a whole different game. And like I mentioned earlier, it's about understanding where the marketer comes in, of how we communicate, what we're communicating, how long we communicate for, because people, we've been saying it through the whole webinar, people aren't going to flip a switch and everybody's going to come. People are still going to be scared. Between the media, what people are reading online, it shoved this fear that this COVID, we're supposed to be afraid of it. So when it opens back up, we have to be smart with how we're messaging that. And I think that's where the marketer's job comes in, to drive those metrics back to where we were pre-COVID, is how to speak to their patients and when.
Thank you. And what about your thoughts on that, Sarah? There's a lot of stuff that Dave brought up that you're seeing every day. Curious your thoughts on the executive perspective, and maybe even some of the things that you concluded with too.
Yeah, so I agree with Jared and Dave. I'll just add to it that I think one of the resources are obviously really tight now. Budgets are being cut. And I think any way that marketers can show additional opportunities and value is going to be really important. So yes, the traditional metrics still stand. But I think it's going beyond, how did that campaign drive value, and how did it engage patients, but also what worked, what call to action drove the most activity, what channel, what content, so that campaigns can really be optimized tightly over time, and resources can be spent accordingly, so that you're more likely to get a higher hit rate in the long run, because you're reaching out to people who are most likely to respond to a specific channel or a specific type of content, or even a specific time of day that you've learned over time through data, and you're really optimizing your campaigns for the highest response performance.
Great. Moving on just a little bit, this is kind of tangential. This goes into the marketing technology systems that we're employing today. So we're seeing, especially with recent moves and the requirements, there was a big battle about this. we're seeing a move into more interoperable systems. We're seeing more use of data science and AI. Question, I want to start with you, Dave, this time. What should marketers focus on from their CRM or CDP type partners?
Yeah, and obviously first and foremost, the most important thing is the data that goes into it. It's the old adage, you know, bad data in is bad data out. So to be on the same page and making sure that those data sources are aligned, they are correct, because this can shape the whole way that you're going moving forward. And additionally, on top of that, one of the other important things with partners are to make sure that you're working together towards this, because you know we're seeing a lot of stuff you know regionally and how that sits, but additionally our providers have this view of a national level. So when we bring those two ideas together, being able to utilize those to be able to co-innovate and try different things, because none of us have been involved with something like this before, whether you know it's COVID. I mean, you know, SARS previously, nothing has compared to what this is and how this is going to change. So being able to have a partner that's willing to stand, you know, side by side with you as you go into this venture is extremely important.
Excellent. And Jared, your perspective on that, just given the move towards more interoperability, APIs, having systems able to talk to each other, data science helping with decisions, your thoughts on what marketers should be looking for from their partners?
Yeah, it's such a good question, because it's such a connection that has to happen. I feel like partners should be helping them not market in a vacuum, right? I feel like helping them understand and make sure the consumer is always at the center of the picture, and how often the consumer is going to change over the next few months. Helping them know where the limits are of your cadence, of your frequency of contact. I think Sarah hit it spot on in terms of consumers are looking for more information right now. So being able to dig in and know when to ramp up your cadence and when to scale it back a little bit, when to hit pause. The right partner can really help with each of those pieces, and helping also recognize how quickly this response cycle is going to change, right? The whole thought of decisions that used to take years are now taking weeks. That's not going to change for the considerable future, right? So the right partner can help with those efforts by really keeping an eye on all the data that's coming back from campaign performance, and realizing that it's going to change quickly. So I guess just not doing any of that in a vacuum, helping provide marketers the right information they can share with their clinical partners for any data that's being shared, any clinical data, especially when you mentioned the growth into more interoperable systems. If anything, that momentum is just going to increase. I think telemedicine will help that increase. And so there's going to be more people, in other words, asking for more data, and marketing is going to own a lot of those pieces. And so the more they can integrate all that together, almost everyone's going to need partners to help understand what they can do with all of it.
Excellent feedback, Jared. Now, we're running a little bit short on time, so I just wanted to remind everybody, keep the questions coming in. We've been getting some great responses already. And Sarah, so we're going to go into a question that's pretty similar to that. I wanted to start with Dave again and to get Sarah's perspectives. But here's the question is, marketers, like all the technology that we buy, we're getting conflicting information on what platform is responsible for what attribution, which point solution is driving the most revenue. Classic example is how Facebook wants all the credit for first touch attribution. The first time anybody sees the newsfeed link on Facebook, they want the credit for that for the conversion, whereas Google wants every single bit of credit for the last touch, even though there's a lot of other things, a lot of influence points that have contributed to somebody's conversion. So given that all these marketers, all these MarTech companies have different perspectives, what can marketers do to get to a system of metrics that they trust? I want to start with Dave on that one.
Yeah, and it's a great question, because it's an argument that I've seen across multiple industries. And when you ultimately look at this, and it kind of ties back to the question that we just touched base on, is, when you're selecting these partners should be all on the same page, because they are ultimately representing your organization and you and the marketer internally. So, you have all of these different MarTech organizations, these different tech stacks. Getting everybody on the same page is one of the most important things, whether that is you holding a summit with all of your vendors to get everybody on the same strategy, see your goals and objectives, what you're organizing to, and being able to see where they play the part in there and get mutual buy-off before you actually dive into this. Because a lot of times is you dive into this and then stuff starts coming through and they're like, oh, well, we brought that in. No, we brought it. So being able to take a step back, get everybody in, sit down, be able to take that time to speak through what we're going to, what we're reaching to, what our vision is, what our mission is, what we're looking to do. And if a vendor isn't willing to do that, I don't think that's somebody that I would personally want to partner with, because it's about getting together and being able to, get to the patient and help the patient. That's all of our end goal, is to be able to help the end patient. And, getting that addressed up front with everybody is one of the most important things to do. It's worth the time, in my opinion, to do that.
Fantastic. Sarah, your thoughts, basically how you establish trust, considering everybody has a different perspective that's kind of self-serving.
Well, I think we have to look at it almost as a journey. And we talk a lot about patient journeys, from the time the patient makes a decision to the time, or starts to make decisions, to the time that they actually act on it. There's actually a marketing journey as well. And that encompasses a lot of different touch points, whether it be a digital ad, a website, a direct mail piece, a SMS, whatever it may be. It's maybe hard to actually attribute to exactly one thing, but you have to look at it as a holistic journey. And tying it back to your previous question just a little bit, Chris, when you think about a CRM partner, I think it's really important to be able to ingest all of that data so that you can see that holistic journey all in one place. So you're not looking at data in isolation, because where we get really tripped up is that we look at, okay, well, here's my Google Analytics data, and here's my Facebook data, and here's my SMS data, and trying to piece it all together. But it's really important to be able to ingest all that data into one place and have it all available for a holistic view, so you can really get a sense of what journeys are working with what types of audiences.
No doubt, huge question on people's minds is how different things correlate and interact with each other, and it can't happen unless it is in one place. Jared, your thoughts, conflicting incentives among all these vendors. How do you find a trustworthy strategy?
I'd say integrate your data sources as much as possible, right? The fewer data sources you're going from, the more reasonable that task is to sort out attribution, to sort out performance, and to ultimately get down to what do you trust. I've seen the downside of not having a source of truth, or trying to integrate data sources that just weren't even really possible to do so, and it's a nightmare, and it can suck up all the goodwill you've had building something on the front end that is working, when people come back and you realize the source of the problem was not having a true source of truth to begin with. So integrating that as much as possible. I mean, it not only gives you better, more reliable, more trustworthy data, it also hopefully makes a better experience for the consumer in the first place. So integration, in my mind, it's one of the biggest tasks, but it's one of the most important.
Excellent. So that concludes the prepared questions that we have, and I really want to get into the questions that we've been getting from the audience. But before that, we always like to end these things with a couple of nuggets that you can take away. So Sarah's going to spend a couple of minutes on that, and then we're going to jump into the audience questions. So again, just as a reminder, Q&A button down at the bottom of your screen. If you have questions, we've been getting some focused questions. If you have questions for anybody in the panel, let us know down below.
Thanks, Chris. Okay, so I'll be quick because I know we're short on time, but just wanted to summarize with a few key takeaways. One, I think we can all agree that that data is king when it comes to reaching patients and reaching the right patients. Use data as much as possible to build audiences, create segments, and customize content. To map out and release a steady stream of content to engage and build trust, and really look at content as a way to not only inform but also educate and be a resource for patients and providers. Communicate frequently and directly, and really kind of look at communications as an opportunity to collect data over time. And that leads to the next point, to use that data to inform who to communicate with, how to reach them, what the message should be. Every outreach campaign is an opportunity to collect data. So the more you're conducting outreach, the more data you're collecting, the more you're understanding who, what, and how to engage with. And then last, monitor channels and modalities for the engagement and conversion over time. Use reports, use metrics, have all your data in one place to the degree as possible so that you can really understand the holistic journey. And last, take action. The time to start is now. And this is really a great time to jump in the game if you're not already, and start using data as a way to optimize content, channel, and calls to action.
Thank you very much. And so along with those takeaways, we'll send those in a reminder email along with the link to this recording and presentation. And now we'll jump into the audience questions, starting with a question that's directly to Dave. So Dave, this is a little bit long, but I think you're going to catch on pretty quickly. So why do you think that healthcare systems, medical groups, hospitals, what have you, why haven't they utilized AI more as it pertains to direct marketing, programmatic promotion, or pushing out treatment options proactively to their population? And as an example, the submitter included so using health data like a A1C, weight, or prior medications to promote or service them. How instrumental do you think this is going to be in the future of business planning or giving systems that are using this data, giving those systems a strategic advantage over their competitors?
Yeah, absolutely. And I'm sorry if you hear some feedback in the back. I apologize, but I think the two major reasons why health systems, the medical groups and hospitals and all those likes have not is twofold. One, it's monetary reason. They're not ready to make the investment, and the second is just ultimately change management. Being able to change the way that the executives internally think versus how the marketers think, being able to show that value. I think those are the two things that really hold up, really hold up getting something like that, like AI and precision marketing and all that instilled in your organization. And it's good to have a champion to be able to show that, be able to show the the benefits, how this is better, and quite frankly the next revolution of healthcare to the patient. But additionally, I think it's like all of those that you see. You could talk about Blockbuster, you could talk about Pets.com. Everybody brings up those references to those older organizations. The same thing in healthcare. If you don't make this shift and you don't change to being able to shift to AI, it doesn't have to be specifically AI, but starting to get more data focused and understanding those personas and the personalization. There's one or two things that are going to happen. I mean, the first is somebody's gonna buy you because you're fading away, or just simply the hospital closes. I think those are the two things that are coming right now. When you see, healthcare is usually, everybody says, 10 years behind other industries. Well, industries have been doing this personalization, this reaching out, this AI data for close to a decade now, and the ones who have fallen behind have faded to the wayside, while others have flourished. And you look at Amazon, I mentioned it earlier, they changed the game. It's changing. So I think it's either adapt or fade.
Excellent. I had a one come in directly for Jared, and it is more of a definition. But how do you define first-party data?
So first-party data from any data from any campaigns you're running yourself versus data you're getting from Facebook ads or Google ads. That's not necessarily first party data. So anything that you fully own, like, yeah, anything you get back from like a Facebook ad or a Google ad campaign, I wouldn't consider that first party data. That they're still crunching those numbers. They're still providing that to you. But your first party data is everything that any campaign you're running.
Fantastic. So I think we have time for maybe one more question. I'm going to open this up. What advice do you have? This came from Susan Tishak from Nebraska Medicine again. What advice do you have to recapture people's trust when it comes to coming back to the hospital to get procedures done versus the fear that they have for COVID-19? I'll throw that one at Sarah. Sarah, you're muted. I'll unmute you.
Sorry. I think what we've seen is that marketing has really become part of the recovery team when it comes to the organization's strategy around bringing patients back safely. We are really on the front lines of communicating to the right patients at the right time, using data to segment patient groups so that we're communicating message to people based on where they are in terms of, do they need to come in for an urgent appointment type? Do they need to rebook an annual wellness visit that can be done virtually? Or are we just trying to broadly communicate around safety? So I think segmenting those patient groups up front is really critical so that the messaging can be targeted to the patient according to who they are demographically. It may be appointment type, it may be age, it may be based on ICD-10 codes, but really segmenting and targeting, segmenting the right audience and targeting it with the right message is going to be really critical to ensuring trust over the long run.
Great. And yeah, I think that really tied into some previous points you made about being in front and it's not just an on switch, but it's a constant communication with the audience. With that, we are at the hour. So I always hate to end it, but we've reached our conclusion point. As a reminder, we'll be sending the webinar link. We got asked about that, and we'll also be sending a couple of other assets that will help you there's a roadmap that will help you kind of take action on the route to moving towards the data enthusiast mindset. So again, thank you very much to our presenters. And if there are any questions, feel free to respond to any of the information that we've sent, and we are happy to help. Thank you.
Thanks, everyone.
Thank you.